Starting today, millions of Beijing residents are undergoing a new round of mass testing for Covid-19 after dozens of new cases were linked to a bar in the Chaoyang district. Describing the outbreak as ferocious, health officials say close contacts and even secondary contacts will be placed in quarantine. Since the cases emerged late last week, the district has suspended the operation of all entertainment venues, internet cafes, underground gyms and sports facilities. China correspondent Elizabeth Law joins us from Shanghai. Liz, how serious is this outbreak in Beijing? Will the city be forced to announce new restrictions, you think?
Well, the thing about the Beijing outbreak is that yesterday, Beijing CDC officials during the press conference had actually said that this outbreak now is in fact worse than the Severity outbreak. If we all remember, Severity happened in June 2020 at a wholesale market. It was the largest wholesale market in the whole of Beijing. And that particular outbreak actually spread to most of the districts and it brought the city into like a semi-lockdown of sorts. But that was about 2 years ago. And now the fact that they're saying that this current outbreak is worse. Today, we've seen numbers that at least 185 cases have been linked to this current cluster, and we believe that it will continue to grow. So we've already seen that there was restrictions. Pubs have been asked to close. Children who were supposed to go back to school today have now had that postponed yet again, and it's been more than a month that they've not been allowed to go to school now. So I think everyone is very frustrated, and people are worried that if the numbers keep going up, the Beijing government may be forced to take more drastic measures. And even though it seems almost unlikely, but nobody is quite certain anymore, because even up to days before Shanghai went into a 2-month lockdown, the government had still said that they were not going to lock down the city and that it would be impossible to do so. So here we are.
Liz, over the weekend, we read your story about the cost of China's zero COVID policy. Sounds like mass testing, quarantines and even lockdowns have become a way of life.
That is true, because a senior government official in the end of May had actually said that she ordered that testing booths now be built within 15 minutes walk of all residential areas in all of China's major cities. So that means that it's clear that zero COVID is not going away anytime soon, even though these are actually part of China's COVID prevention playbook from dating back to the very early days of 2020, the sort of test, trace and isolate measures. They still are very much dependent on it. And the fact that they are now building semi-permanent booths, testing stations all over the city. You can't walk and get to a street corner without seeing a testing booth. It really means that they are committed to this. And in a way, this has also helped to drive a part of the economy. Now, each of these booths costs between about 30,000 to 40-something thousand yuan. So for the Singapore audience, that's about 6,000 to 8,000 Singapore dollars. And it is actually fairly good money because the construction cost is very little. So you see people in industries like people who make portaloos, people who make air conditioning units, people who make security stands now pivoting towards making these sort of testing booths. And even though they are sort of being used for medical purpose, they are not actually governed or subjected to any sort of health regulation. So it is actually very easy, very quick money, and everybody is capitalizing on it.
Liz, separately, you've also written about your experience testing positive for COVID-19 in China, where you spent 11 days in a hospital. Tell us about that.
Well, so I think as most people in Singapore know, and it is the same in the rest of the world as well, that if you test positive for COVID and you are not supremely unwell, you essentially isolate at home for about a week. And then after that, it is back to daily life. Or in some places, even you could go back to work earlier as long as you wear a face covering or mask. Now in China, of course, because of their super strict zero COVID measure, once my swab at the airport had come back positive, because I entered China from Singapore, I was taken to a first hospital, a triage hospital, for confirmation test. They swabbed everything. They took a lot of blood. And then I was sent to a treatment hospital where they took even more blood. They took 14 tubes of blood at the treatment hospital, did more swabs, and also sent me for a CT scan. Essentially at the hospital, because all I had was a scratchy throat, there was nothing much that they could do about it except to just let me wait until I tested negative. And so I would get swabbed every morning between 5 and 5:30. They were essentially looking for a CT value of 35. Now, CT values refers to the number of times the swab sample needs to be amplified before the virus can be seen. So it took me about 11 days to eventually test negative. But after that, I also had to spend 7 days in isolation in a government vaccinated hotel. Still could not be released out into the public. So I've only just regained my freedom yesterday, and I can move around Shanghai. But my health code for Beijing is still red at the moment, and also my passport number has been put on a blacklist, which means that I'm not allowed to book any travel tickets.
Elizabeth, thank you for the sharing, and do take care of yourself. China correspondent Elizabeth Law. 21 nasal and mouth swabs, 17 vials of blood and 2 CT scans. For more on what it's like to be COVID-19 positive in China, you can read Elizabeth's full account online at str.sg/Asia. Thanks for watching. Be sure to subscribe to the channel and hit the bell icon to be notified of new videos.